So today we'll be talking about a very commonly asked differentiation that is between conus medullaris and cauda equina. We must know that conus is the lowermost portion of the spinal cord. That is the reason why, and it is cone shaped, so it is called conus. So it is the lowermost portion of the spinal cord. That is the reason why whenever it is involved, this conus or the lowermost part of the spinal cord, it usually involves the sacral components, that is S2, S3, S4 and S5. So as we know, whenever there is damage to this conus, we must know the spinal cord comes under upper motor neuron, and whatever comes out of the spinal cord, especially after the anterior motor horn, is element. So the spinal cord is a component of UMN, that is upper motor neuron, that is from brain to the spinal cord. So in conus medullaris, as there is direct involvement of spinal cord directly, we get this upper motor neuron signs. So that the whenever we see the plantars can be extensor. So plantar will be extensor, that is sign of UMN. And whenever plantars are flexor, we call it as element, or that can be element. So here S3, S4, S5, these roots are involved. And we must know that this S3, S4, S5, these are integral part for sexual function. So for sexual erection, sexual pleasure, this S3, S4, S5, they are very important. That is the reason why in conus, as there is involvement of this S3, S4 and S5, there is impotence. So impotence is because of the involvement of S3, S4, S5. Whereas in cauda equina, we must know cauda equina. Equina means horse and cauda means tail. So it is a horse tail like structure. These are simply the roots that all emerge from the spinal cord. We must know that the spinal cord ends at the level of vertebral L1. So below vertebral L1, all we have is L2, L3, L4, L5, then S1, S2, S3. These are all the roots which originate below L1. And in cauda equina, these roots are damaged by some or the other reason. There can be disc prolapse, there can be any abscess, there can be any lesion, there can be some bone fracture, or there can be some bone piece that causes damage to the nerve roots. So this falls under LMN lesion, that is lower motor neuron type of lesion. So we can get the plantar, which is flexor. So here the nerve roots are affected, whereas in conus the spinal cord tip itself is affected. So it is UMN, upper motor neuron. This is element, that is lower motor neuron. So we get element signs. So what are element signs? Element signs is significant atrophy and flaccidity. Whereas in UMN, what we get is spasticity, and atrophy will be there, but it will be slightly delayed. So as the spinal cord is involved, it will cause damage to both bilateral S3, bilateral S4, bilateral S5. So the presentation will be always symmetrical. Whereas in roots, only one-sided roots are usually involved. It can be both, but most of the time only one-sided roots are involved. So the presentation is almost always asymmetrical. We must know it is human, the conus is human upper motor. So we have is a spastic bladder. So after some time, the patient will have to go for urination. Whereas in conus medullaris, as it is element lesion, the bladder involvement is much late, and there will be overflow incontinence. Means there the patient will have continuous dribbling of the urine because of the fullness of the bladder, because the bladder will be already full. So whatever extra urine is accumulated, the patient will have dribbling of that urine. And in conus, as we know, this is the typical S3, S4, S5 involvement, which is very much required for bowel, bladder, and sexual function. We have very good mnemonic, that is S2, S3, S4. Keep the pee off the floor, means it is required for the bladder involvement. So presence of conus medullaris very commonly involves bladder. So bladder involvement is much early in conus medullaris, whereas it is late involved in cauda equina because there is usually unilateral. In conus medullaris, we know that muscle involvement or weakness is very mild, whereas in cauda, as the main L2, L3, L4, L5, S1, S2, S3, these are involved very commonly. We know that lower leg muscles, that is thigh muscles, calf muscles, and foot muscles, the roots which are supplied to this thigh leg, these are all lumbar 2, lumbar 3, lumbar 4, lumbar 5, and onwards. So major chunk of muscles of thigh and calf, they all have root values of L2, L3, L4, and up to L5. That is the reason why there is severe muscle weakness, severe muscle wasting, which will be seen in Cauda, whereas Conus only S2, S3, S4, S5, these are involved, and these root values are usually supplies the foot muscles. So thigh atrophy will not be there, calf atrophy will not be there, but foot atrophy will be there. So in conus, the signs will be bilateral, whereas in cauda, the signs will be unilateral. As the roots are not involved, the radicular pain is usually absent in conus, whereas as these roots, these nerve roots are very commonly compressed, pressed, injured in cauda, root pain is very common. So, as I told, for sexual erection, sexual pleasure, S2, S3, S4, they are very much important. So, impotence is very frequent in conus, whereas it is not seen with cauda because the main involvement in cauda is L2, L3, L4, L5, and some portion of S. We know the spinal cord it's at the level of L1. So in conus, it is L1 vertebral anatomical lesion, whereas in cauda, it is below L2 because all the roots, the spinal cord ends at L1. So whatever roots are involved, which are unilateral roots, they all will be below the L2 vertebral lesion. I already told that there is sacral segments, whereas in cauda there will be lumbosacral segments. We must know in conus, knee jerk will be present because knee is supplied by L2, L3, L4 nerve roots, and these are more of a spared in conus, whereas these are the most commonly involved roots in cauda equina. In conus, ankle will be absent, and in cauda equina, both ankle as well as knee reflexes are absent. This urinary fecal incontinence is very commonly seen with conus, and distal paralysis of foot muscles only will be seen in conus, whereas in cauda equina, there is significant atrophy of thigh muscles, calf muscles, and foot muscles as well. There will be extensor Babinski sign because conus is human, whereas it will be flexor because this is a human lesion of cauda equina. So, in short, if there is symmetrical, severe bowel, bladder, and sexual dysfunction and signs of bilateral involvement, it has to be conus. If thigh muscles, calf muscles are spared, if knee is preserved, it has to be conus. Thank you.